The state health director told KITV today her department is suffering from a lack of accurate information about how much H1N1 vaccine has been shipped to Hawaii and how much doctors and other health care providers have actually used. KITV's Keoki Kerr joins us live with more about that. Keoki.
Well, Gary, state health officials met with the Healthcare Association of Hawaii as well as several large healthcare providers today to work out concerns about how the swine flu vaccine is being distributed.
If the health department is going to manage the scarce number of H1N1 vaccines in Hawaii, it has to know how many vaccines are in the islands and who has any leftovers that can be sent elsewhere. But State Health Director Dr. Chiyomi Fukino admits,
well, the problem is we don't really know who all's got what and what they've used.
First off, she says 3 vaccine tracking systems, one from the CDC, one from the state, and a third from the vaccine distributor, are showing different numbers of vaccines in the islands. So it's impossible to get an accurate account of what's really here.
We know that there's a problem with these 3 systems jiving.
Fukino says it's impossible to manage the vaccines if the state doesn't have an accurate count of how many vaccines are in Hawaii.
You folks come and you talk to us and say, well, what about this, what about that? And we're reluctant to, give you a number because it's not jiving on all the systems.
A second problem, the state says healthcare providers have sent required information detailing who they've inoculated for only about 25% of the drugs they've received so far. That means the health department doesn't know whether the other 75% of the vaccines here have been used or are just sitting around.
We need to know about that so we can redistribute it to someone who can use it. And we encourage all of our providers to use their vaccine as they get it.
Hospitals, doctors, and medical groups have been asked to either send a vaccine form in the mail or enter the information into an online database so the state can keep better track of the vaccine.
Fukino tells us that, relatively speaking, there is more of the nasal spray H1N1 vaccine available here compared to the injectable vaccine. That's the one you get in your arm. That's because pregnant women, people over 49, and anyone who has a weakened immunity system can only get the shot in the arm version. So if your doctor or clinic is out of the shot, you can ask about the nasal spray. Keoki Kerr, KITV4 Island Television News.